We have decided that the Solve as a currency of the platform of the ecosystem of all the networks normalizes our networks across the planet. So Solve token is the currency in which we actually receive a revenue. It's also the currency in which you, the card publisher, receives the revenue. It's also the currency in which the care administration network sponsor measures the utilization and efficacy of their network. And it's also the currency the wallet holder uses to consume self-pay care cards if nobody else is paying for them. So when clients license our platform and stand up a care administration network or multiple care administration networks, they have to load appropriate number of Solve tokens in their master wallet. And as that network is operated or utilized, those wallets are drawn down. And once the balance falls to a certain level, they have to replenish their master wallet. In other words, they have to maintain a certain amount of Solve tokens in their wallet based on the past and projected utilization of their care administration network. When consumers use Care wallets, they can download the Care wallet for free and join some Care networks for free. But when they join, they consume cards that require a monthly payment or a one-time use card. They have to pay for those cards. And if they choose to download and use those cards, they need to have Solve tokens in their Care wallets. Now, the most exciting part of our system is the ability to sponsor care for people you care about. Whether I'm as a parent want to care for my children, or if as a son, I want to care for my mom, I have this tremendous capability of sponsoring care for people I know, my employees, my community members, my children, my parents, my family members, my coworkers. I can sponsor care for them by issuing them the ability to use certain care cards and or to join certain care networks, and I can pay for it using my tokens in my wallet. The idea here is that healthcare is never a solo sport. No one lives or dies in a vacuum, and healthcare typically is a team sport. A lot of people get involved in the care of a single patient, whether it's obvious or below the surface. And those people have a role to play in your wellness and in your outcomes and in your healthcare risk and your healthcare benefits. And typically, those people have also a role to pay for some of this care. And that sponsor of your care can be somebody who just cares about you and wants to issue you a care card to take care of something that you are not able to take care of by yourself. For example, if my mom is in a certain prescription and that prescription is quite expensive, and even with an insurance company behind her, she might have to write $150 to $200 month a week check to pay for her out-of-pocket expenses. I can step in and sponsor that prescription and ensure that the refills that are happening are paid for using my wallet tokens, and she doesn't need to worry about it. Or something as simple as making sure that when she needs to go see the doctor, that I send the transportation company that will take her to the doctor so she doesn't have to pay for a taxi. There are many ways and many use cases for sponsored care, but our platform allows for this to happen on a need basis, demand basis, or on an episode basis, or on a sponsored care model. So very powerful system where people who care about others can deliver care to those who they care about, whether they're local or remote. Think about the scenario where parents live in a village, kids have grown up and moved to a town where they are building a career, and they call in and they check on their parents and they get a standard response, I'm doing fine, don't worry. In the meanwhile, their health is degrading, they're not taking care of themselves, they cannot afford to take care of themselves, or they are dealing with clinical or mental health issues, loneliness, depression, all those things that lead to the worst possible outcomes. As a responsible adult child, I want to make sure my parents and grandparents are getting the care they need, but I have no real insight into that. With Care Wallet, I can sponsor their Care Wallet. I can sponsor the Care Wallet for their physician, cause their interaction to occur, monitor their interaction and their transactions, and step in and pay for it or to coordinate care when needed. So in terms of elderly care or home care or mental health or chronic diseases, this becomes a really powerful way for people who care about each other to also deliver care to each other through the form of Care Wallets. And again, you can use your tokens to pay for it.